All right, welcome back to Morning at NTV. We have some interesting news that is coming onto our desk. Well, the Ministry of Health has called for the deportation of 22 nationals from different countries considered to be high-risk countries for the coronavirus outbreak. The individuals who had arrived in the country to attend the Uganda-Europe Business Forum have been told to leave the country for failure to comply with the new coronavirus protection measures. This was revealed by the Minister of Health, Jane Ruth Aceng, while inspecting the screening process at Entebbe Airport, that is last evening. Ivan Walunyolo was there and has the latest.
Thank you very much, colleagues, and we are coming to you from Entebbe International Airport, whereby we know coronavirus has become a subject of discussion across the globe, but also back here in Uganda, our country. Also, efforts being made to make sure that we, the people living in Uganda, the Ugandans, and more so the rest of other people who come into the country are safe from coronavirus. We have just had the minister touring and inspecting the screening process at the airport. But of course, just a few hours and days ago, you had rumors spray all over social media that there is a group of people who have been, found with the virus in the country. But all of these questions are going to be responded to by the minister herself, Jane Ruth Aceng. Madam Minister, welcome with me on Morning at NTV.
Thank you very much.
What probes you this time to yourself come and do the inspection of the screening at the airport?
Well, first of all, ours is teamwork, and it is very important that I interact with my teams on the ground to motivate them, to show them that we are together in this, to encourage them, and also from time to time remind them about the procedures that we are undertaking and the importance of the procedures, and to remind them that we are here to protect 42 million Ugandans. And my coming here indeed also gives me opportunity to see what is on the ground firsthand, so that when I'm responding to some of the rumors that keep on coming up, I can tell people this is not true. You're free to go to the airport and see for yourself what our teams are doing. And I must say, the teams are doing a good job, a commendable job, and I'm extremely proud of them.
There has been rumors that there are some people who have been, found positive with the virus and, somewhere isolated, we don't know, or quarantined. Give us a brief and clarification on that.
Well, for people spreading the rumors to start saying that there are people who have been found positive is absolutely wrong and not right, because you can only declare someone is positive after blood samples have been taken and they have been proven to be positive. There is no positive case of coronavirus in the country. We have been taking samples of people that we have suspected could have the virus, and to date we have screened over 20 samples that have all turned out to be negative. Yesterday, that is the 7th of March, we isolated about 22 people, not because they had signs and symptoms of coronavirus, but because they were coming from the Category 1 countries.
When you talk about Category 1, Honorable Minister, what are you referring to? People would want to understand.
So Category 1 countries are countries that have, first of all, a high number of cases of coronavirus, and two, they have an exponential increase in the number of cases on a daily basis. So we sat down in the ministry with the experts and we categorized the countries. They were categorized into three based on three criteria. And the three criteria was if you had 100 cases or more. Number two, if the increase in number of cases on a daily basis are more than 10, and you already have community transmission. Number three is if you have an exponential increase, like you jump from, say, 20 today to 40 tomorrow. That is a big increase in one day. And so we get worried when you have a local transmission and you're having an exponential increase. So we categorized 7 countries into that group, and these countries include China, that started with the outbreak, and then we have countries like Italy, we have Spain, we have Germany, we have France, and the other country is South Korea. So when we have people coming from these countries, we want to quarantine them for 14 days for observation. Why do we do this? Because coronavirus has a long incubation period, 2 weeks, and you can develop signs and symptoms on any day of the 14 days. And so it would be risky to allow somebody from this country who may not be having signs and symptoms get into the country, and then later on, say on the 7th day, on the 8th day, or even on the 11th day, develop signs and symptoms. So that would be missing, and currently there are no screening kits or screening tests that can detect that somebody is already incubating. Because what we use for screening is what we call PCR tests, and these detect the antigens. So the antigens can be detected perhaps 2 days before you show signs and symptoms, and during the time when you show signs and symptoms. The antibody tests can only detect antibodies when they peak, and by the time the antibodies are peaking, you're already sick and you're showing signs and symptoms. So it is absolutely not right to take a risk from a public health point of view. It is better to prevent rather than fight when you already have a case in the country.
So who are these people? Where were they coming from?
Well, Uganda is scheduled or was scheduled to have a big international conference. This is the Uganda European Business Forum that will be taking place in Munyonyo starting from tomorrow. And it is attracting participants from many countries all over the world. And some of the participants were coming in from the 7 countries in Category 1. Information should have reached them earlier that they will be quarantined. Unfortunately, we regret that information didn't get to them, so they came into the country, but they were gently advised by our teams that are doing the screening that they will be expected to undergo a 14 days quarantine. So obviously it does not make sense if you're coming into the country for 2 days and you're quarantined for 14 days. So they opted to go back to their homes, and they will be flying back today. They couldn't board the plane yesterday because they don't have the tickets. So they had to do the reticketing so they can board today and go back. But not all the 22 were participants in this conference. 17 were participants. 5 were students that were coming for an exchange program with Makerere University. And that means they were going to stay a little longer, but they are not happy to undergo quarantine for 14 days, so they've opted to go back and perhaps return when the epidemic has been completely contained and the world is no longer under threat, which is another good option. So they can come in and have, their interactions with other students freely.
Honorable Minister, you said it clearly. These people were coming for a short program, which was the conference that you were talking about, and they were to go now for 14 days of quarantine. Does that in any way show that probably we could be drawing closer to having a travel ban as well, because it seems to be indirect travel ban?
Well, we are not having a travel ban. We could say perhaps that the communication didn't travel fast enough. Because if people are well informed, then they can plan. You can plan to come into the country and stay longer, or you can plan to wait, postpone your travel, because what we are saying is non-essential travels should be delayed. And I do hope that in future, people will be able to read on our website and see the information that is there, and also interact with their embassies so that they can access this information, or our missions abroad, so that they will be well informed whether they will be free to go into the country and not undergo quarantine. But this also goes for our Ugandan nationals who are in those countries, because a number of them also had intentions of coming for this particular conference. But when you're a Ugandan national in the Category 1 countries, you will also be expected to undergo quarantine for 14 days.
You have given us the update about the screening here at the airport, but we also have some other borders, Busia and the rest. Also give us an update. How is the screening process in those areas?
Well, the Ministry of Health and the entire National Task Force is aware that we may have people crossing into Uganda from other points of entry. And we have points of entry on the eastern border, the western border, and the southern border. And we are aware that planes can land in Kenya and people cross over, or through the DRC, or through countries in the south. And so we have instituted screening at several border points. We are screening at Malaba, we are screening at Busia, we are screening at Eregu, and we are screening down in Kisoro. So whoever wants to access through these points of entry will also be screened. The similar screening is going on. And remember, we still have screening going on at Kasese for those who may want to cross in through DRC, because we already had screening there for Ebola. We are now on 13-day countdown for the Ebola threat from the DRC, but we cannot dismantle that screening because it is not only for Ebola, but it is also for other outbreaks and people who may want to cross over from there.
Is it true that we have a crisis on masks?
Well, generally, there is a shortage of masks in the entire world because this outbreak did not find the world prepared with masks. However, many manufacturing companies are being encouraged to manufacture the masks. And when I talk about the masks, I mean actually what we call the N95 to 100 that have the respirators, not the face masks that you find people putting on. The face masks are not helpful. The other specialized medical masks are the helpful ones that our screeners should have if they are to protect themselves and also protect people who are coming in. However, for other people who may have mild flu and cough in our country, it is also good that they put on masks to protect others. Uganda has made orders of masks in readiness for any eventuality that may occur. And we want to ensure that people who are screening at all points of entry have these masks to protect themselves, but that we also have adequate masks in the event that we have any epidemic in the country.
We're using Entebbe General Referral Hospital to isolate the suspects. The isolation center, which is national, is currently undergoing remodification, as you said. When do we hope that maybe we shall have to shift from the referral hospital to the isolation center as soon as it's finished?
Our target is to see to it that the National Isolation Center is complete and ready for use by the end of March. So we are monitoring the contractor very closely and encouraging him to have as many workers as possible on the ground so that we run this race towards the end of March and have this isolation facility available. In the interim, we are obviously not taking chances. We have prepared Entebbe Regional Referral Hospital for purposes of isolation, and we are also looking at a bigger picture, getting part of Mulago Specialized that is ready also prepared for purposes of isolation.
Well, what are some of those key things that you think Ugandans should put in mind in as far as you were fighting for this cause?
Well, first of all, again, I want to re-emphasize the messages that we have been passing on to Ugandans. And I will start with the issue of self-quarantine. I want to appeal to Ugandans who are traveling into the country, that have come from these countries that we have identified, that when you are requested to go under self-quarantine, please adhere to the rules. You may be a Ugandan, you may be back at home, you're most welcome back, but adhere to the rules because we need to protect other people in this country. Number two, I want to again re-emphasize the issue of avoiding handshakes and hugs at all times. It is not necessary. For purposes of infection control, let's avoid handshakes and hugging. And again, I want to re-emphasize the importance of hand washing at all times. Please wash hands with soap and water, or use hand rubs. Avoid touching your eyes, your nose, and your mouth at all times. In fact, my appeal to you is to remind yourself every day that your mouth, your nose, and your eyes are out of bounds for now. Repeat it to yourself several times so that you avoid touching it, and repeat to yourself that you need to wash your hands. For those who have signs and symptoms of flu, cough, and a running nose, please do not go to areas where there are people, like offices, like crowded places. Stay at home until you are better. And if you feel worse, report to the nearest health facility or call the toll-free lines that we have been giving out whenever we read any messages. We have issued out guidelines for mass gatherings, and we request that these guidelines are followed, and we have hand sanitizers and facilities for hand washing at all these places. We expect that the population will cooperate with us as we strive hard to ensure that you are well protected, our country is protected, and each and everybody remains healthy.
Honorable Ruth Acheng, thank you very much for talking to us on Morning at NTV.
Thank you. Have a good day.
Well, you get it from the Honorable Minister herself, trying to emphasize that the public should take caution as far as how they're also putting their efforts into implementation to make sure that Uganda as a country remains safe. Well, I want to hand over back to you in the studio so that you continue with the rest of the other discussions. A very good morning to you.
Well, thank you very much, Wolonyolo, for that update. Minister of Health, General Acheng, telling the country you need to adhere to the WHO measures that were given to the world to contain this coronavirus. Please adhere to that, avoid large gatherings and all that. My name is Romy Busiku, and the show has unfolded.